Assalamu alaikum and welcome to the platform of Pharmapedia once again with the new video of the drug series, that is Brufen. Brufen is basically the analgesic drug. So from today we are going to start the analgesic series, and the first drug of this analgesic series is Brufen. So what is basically Brufen? A non-steroidal anti-inflammatory drug that is NSAID, used as an analgesic to reduce the fever and treat pain or inflammation. So basically it is an anti-inflammatory drug or analgesic drug. Brufen is a core medicine in the WHO model list because it is an essential medicine necessary in the minimum medical need of the basic healthcare system. Secondly, it is the most commonly used drug in the Pakistan, or the second most commonly used drug after acetaminophen in the Pakistan. So it is marketed with the brand name of Brufen. It is also available as the Brufen-DS, that means the double strand, and it's available under the variety of the popular trademarks such as Mortin and Advil. It has an anti-platelet effect and acts as a vasoconstrictor. That means it constricts the blood vessels. So its uses, as you see in the previous slide, it is used as an antipyretic, so it uses fever. It is used as an anti-inflammatory, so it is used in inflammation. It is analgesic, so it is used in headache, toothache and back pain, arthritis and minor injuries. Now what is the basic mechanism of NSAID, that is Brufen, we are discussing in this video. So what is the basic mechanism of NSAID or Brufen? Work by inhibiting the COX pathway, which convert the arachidonic acid to the prostaglandin, which is converted by the other enzyme to the several other prostaglandin, which are the mediators of the pain. Prostaglandin are the endogenous, so it is a mediator of the pain, inflammation and fever, and to the thromboxane A2, and it stimulates the platelet aggregation, leading to the formation of the blood clot. So this is quite difficult mechanism inverse to understand. So let's summarize this mechanism that is visualized in this picture. NSAID act on the COX pathway, so ultimately arachidonic acid is not converted into the prostaglandin 1 and 2. As you can see in the picture, prostaglandin is essential to protect the gastric mucosa and platelet and kidney functions, while in the case of the prostaglandin 2, it have the major functions in the fever and pain, so also in the inflammation. So when there is no prostaglandin 2, there is no fever and pain and inflammation. So this is basically the mechanism of action of NSAID, that it inhibit the cyclooxygenase or COX pathway, so ultimately no prostaglandin and no fever, pain and inflammation. That's why it is analgesic, antipyretic. Antipyretic means it reduces the fever, and anti-inflammatory in action. Now the doses. Usual adult oral dose for the mild to moderate pain is 200 to 400 mg. As I described, it is also available in the DS, so this DS is 400 mg. Orally every 4 to 6 hours as needed. Under medical description, the maximum amount for adult is 800 mg per dose or 3200 mg per day. It's basically based on the patient condition, based on the individualized response and tolerance, that means the individualized therapy. Now the next is OTC preparation of Ibuprofen. In journal label to advise a maximum daily dose is 1200. That means if you take in the Ibuprofen or the Brufen as an OTC medicine, so you are only allowed to take the 1200 mg, because you can use 3200 mg under the medical supervision only. Now the side effects of the Brufen. Brufen appear to have the lowest incidence of digestive adverse effect reaction of all the non-selective NSAIDs. nausea, dyspepsia. These are the side effects basically. GI ulceration, bleeding, diarrhea, because it also block the COX pathway, so there is no prostaglandin 1 production. So ultimately, when there is no prostaglandin, so there is no safety and protection effects of brufen you can get. Now other side effects are constipation and hypertension, and its major drug interaction with the ACE inhibitor. Brufen having the major drug interactions, and it may diminish the antihypertensive effect of the ACE inhibitor because of its cytochrome mechanism or cytochrome enzyme that are present in the liver. Now with the aspirin, administration of the brufen and aspirin is not generally recommended because of the potential for increased adverse effect, and with the diuretics it can reduce the natriuretic effect of furosemide and thiazide in some patient. The patient should be observed closely for the sign of the renal failure as well as to assure the diuretic efficacy. Warfarin type anticoagulants, user of both drugs together having a risk of serious bleeding higher than the user of either drug alone. Why? Because it also having the antiplatelet activity, so ultimately the risk of bleeding increases. It have also the major drug interaction with the MTX, that is a methotrexate. So its major contraindication are with asthma, hypertensive patients, heart attack, stomach or intestinal ulcers, because the major side effect of the ibuprofen are GI ulceration and the GI disturbance, liver problems and blood clotting disorders, bleeding of the stomach or intestine, kidney disease. Pregnant in the third trimester must also be contraindicated with the ibuprofen. Or obviously the major contraindication of the all drugs, it is contraindicated if the patient is hypersensitive to brufen. So the major uses of the brufen in the dentistry are the combination of 600 of brufen with the 1000 mg of paracetamol taken every 6 hours increases pain relief compared with the brufen taken alone, because it is a strong analgesic with the higher doses, and the dental pain is for more severe pain. Brufen and codeine, which enhance the brufen analgesic but with an increase in adverse effect also, because it having the chances of greater toxicity and adverse effect with the higher doses. Use of gel capsules that provide the faster absorption and therefore a quicker effect. So that's all with this drug and with this topic. That is the first topic and the first drug of the analgesic series.